stuck? Are you broke? If so, why? Why haven't you made any changes to live the life you want? It all comes from your daily habits, your routines, your thoughts, your actions. What's cool is that all of this can be changed quicker and easier than you think. Follow the steps mapped out in the habit formula and start to change your life today. Go to thehabitformula.com for more information.
Hey everybody, you know what time it is. It's lunchtime with the Habitmaster. And I'm Dr. Stephanie Aldrich, your host, and what I do is help people get better habits by tweaking what they do in their daily lives. And when you tweak your habits and you improve what you're doing, the actions equal the results, and your results will be different, right? So today is Tooth Tuesday, where we talk about dentistry, we talk about health in general, and today's topic is something that I think a lot of people suffer from, and that is headaches. Before we get started, I want to congratulate the following people for grabbing their free copy of the Habit Formula. And these guys are Manohar Raja, Tina Starr, Scott Brown, Laura Williams, and Sarah Maynard. Tina, Scott, and Sarah also upgraded their orders to one of my premium courses. And they did that because they want to get results faster, because they want to do the deep dive and they want to really study this material so they can repeat and wash, repeat and wash, repeat and wash, and do different things in their lives, whether it's professionally or personally, and get different results. So I want to congratulate those guys, Tina, Scott, and Sarah, for upgrading their orders. I know you're going to love the program, and if you have any questions, just email me on the email address that's in the course, and I can answer any questions. So today we're going to talk about headaches, and I was looking up some stats for headaches, and we got a couple big numbers here, okay? 10 million Americans suffer from what we consider, I have TMJ problems, okay? As a dentist, we call it TMD, TMJ disorder, that kind of thing. So they have some kind of popping, clicking, making noise almost like a gravel sound in their ear when they're eating something, right? But also they can have headaches, and sometimes you don't know if it's actually a migraine or if it's a tension headache from grinding or clenching at night. And we're going to kind of talk about that here in today's episode, so that you yourself, if you're suffering from any type of headache or the clicking and the popping, or your bite's off, you can't chew the way you could chew before. Maybe it gets tired after you're chewing gum during the day. Maybe you can't open as wide as you used to. That could be some type of TMJ disorder that we'll talk about, and we kind of group all of this stuff together because it has the same cure or treatment, I should say, that we can handle in the dental office. So the next number is an even bigger number, and that's 30 million. 30 million people suffer from migraine or tension headaches. And those are the people that actually went to the doctor and say, look, I'm having these symptoms more often than not. What can you do for me? Okay? So a question you got to ask yourself is, when you wake up in the morning, how do you feel? Do you wake up with a headache? Do you wake up with tightness in your jaw, with the popping, clicking? Were you tossing and turning all night? There's a statistic that said there was a study over 1,283 patients with migraines that 71% of them woke up with or by, because it was causing them pain, a morning headache. And usually the headaches started between 5 and 8 a.m. And there's a reason for that. Everyone clenches or grinds a little bit at night, depending on what type of sleep we're in. The heavy, REM sleep, or the heavier sleep, other than the REM sleep, which is when you first start going to bed. You have the rapid eye movement sleep, so you're not in that deep, heavy sleep. Once you get into that deep, heavy sleep, sometimes your mouth starts moving, right? Maybe you're running through the forest. You're having some crazy dream where you're doing some kind of activity. Maybe you're scared. Maybe you're stressed out about a situation in your dream. That can cause your body to reflex and, cause you to move your jaw a little bit and to clench or to grind a little bit. Also, depending on, your sleeping patterns. Are you sleeping on your side? Are you sleeping on your stomach? That can also force the jaw into a weird position, and that can cause issues. Okay, so we're going to talk about more along the headache realm today, but the treatment for a headache or a TMJ disorder problem is basically the same thing, okay? And we try to get away from migraine medications and actually get to the root cause, okay? Migraine medications don't necessarily get to the root cause. They kind of put a band-aid on what's really going on. Is there a chemical issue, or is it more of a physical strain on the musculature that's building up toxins and causing the headaches? And that's something that, if you are suffering with headaches or the popping, clicking of the jaws or whatever, we're going to have to get down and dig deeper into your symptoms and try to figure out what's causing those issues. Okay, so between 5 a.m. and 8 a.m. I was surprised about that when I started looking over stuff. There's a couple of common drugs that people do use, that physicians will put you on. One is Topamax, and another one is Botox. And sometimes with injections, they can treat the patient. What they found in one of the studies that I read is that Topamax and Botox both reduced the migraines almost by half. It was like 45% compared to a bite splint, which was 75% in the reduction of headaches. So we can get a lot better result if we can separate the jaws, stretch out the musculature, and prevent them from locking into place and causing harm. So we're going to talk about that, and I've got a couple examples today I'm going to show you of bite splints. By the way, August and January are our 2 months that we see a lot of TMJ/headache patients. And over the years, I just decided, hey, I'm making so many of these bite splints, let's have a special. So you've got 1 more week left of us having a special of $100 off. We have some insurance companies that pay for all of it. We have some companies that pay for part of it, usually half. And then we also have company plans that don't pay anything. So I'm not sure what insurance covers for you and your plan. That's something that you're going to have to jump into with your employer or your dentist. I know we always check on things to make sure that what your plan covers. We call them when you become a new patient here, and my office manager Della will call the insurance company and say, hey, here's the plan. Tell me about a TMJ bite splint. Does the plan cover it? How much? This and that. and then we can do something. So this month we're running a special for $100 off. So if you think you have any of these symptoms, at least come in for a consultation. Or if you don't live in the Akron area, make sure you go to your dentist and say, hey, you know, maybe you have been taking Topamax and you're like, or getting Botox injections, and you're like, look, I'm sick of this. Let's see if maybe one of these bite guards can help me, because then you're off the drugs. You're going to start feeling better, because a lot of times Botox and Topamax have side effects that aren't that great, right? Well, a bite splint, all you do is wear it at night. If you grind through it, you break it, the dog chews it, whatever, guess what? We can make another one. It's very easy to do. It's a goopy impression, or we just standard fit it into your mouth. It's really easy, and it doesn't take too much time. So that's something that you should definitely think about. If you are suffering from headaches, you're waking up with a headache, or you're feeling the other TMJ symptoms, which is tightness right here, which is in your temple, okay? You have a main muscle that goes around here from your temple all the way to your end of your jaw, right? And that's the muscle that gets stressed out when you are clenching or grinding at night. How do you know if you're clenching or grinding? So let's get into that. Clenching, you're waking up either with a headache or muscle soreness right in here, okay? Usually people that are just clenching do not have any wear on the tops of their teeth. People that are grinding side to side, even if it's just a little bit or front to back, the edges of their teeth are always worn. They're always worn down, especially if they've been doing it for a while. And they have similar symptoms. They have tightness in here. Sometimes they'll have a headache. Sometimes they can't open as wide. And also, sometimes their bite is off. And they're like, what is going on? It's not that hard to dislocate this joint here, okay? Because it's not a true ball and socket joint where it fits tightly into the joint. It kind of just rests there. And depending on, did you get hit with a ball? Did you sleep on your stomach all night in a weird position? It can easily come out of the jaw either way. And I've been having a lot of people in the last 2 weeks. I've sent, I think, 10 people over to the chiropractor because they actually did dislocate their jaw. 2 guys, no injury, no accidents or getting hit with a ball or falling or anything like that. But 2 guys, they just woke up and their teeth were completely mismatched. Their jaws were not aligned at all. And I said, you know what? I think this joint is dislocated a little bit. And obviously they were having pain because it wasn't sitting in the joint correctly. I sent them straight to my friendly chiropractor. So let's say that you do wake up and you're like, oh my gosh, not only do I have sharp pain, my jaw isn't meeting right. My suggestion is, if you can't go and see your dentist right away, my suggestion is go and get an appointment with your friendly chiropractor. They will know how to put that joint back into its socket so that everything feels better, because you are going to really stress out those muscles and the joint itself, and you don't want any type of damage there. So that's something to think about. If you're waking up with a headache, more than not. So let's say you're waking up with a headache, a few times a week, 2 or 3 times a week, okay? And this is something that's been going on for, at least 3 weeks, 2 weeks, 3 weeks. To me, there's something going on there. And if it's not a chemical issue, if you weren't taking medications for something and then you just got off of it or you're weaning yourself off of it, that can cause a headache, right? It's almost like a withdrawal symptom. But if none of that's going on and you're just all of a sudden having headaches, and it's not necessarily a TMJ issue where it's more soreness, it's just flat out all over the place on your head, flat out headache in the morning, then you may be clenching at night. And that's a little harder to diagnose because I don't see any wear on the teeth, right? You're not really having any other symptoms except you're just waking up with a bad old headache. If it's going on for more than a couple of weeks, a great thing to do is go to the dentist and have them check you out to see if you really have a tension headache. And if so, more than likely one of the bite guard products can help you. So what does a bite guard product actually do? So I am going to attempt to draw some things, and I apologize, I am not an artist, right? Okay. So we've got, I'm just going to draw real generic, right? So we've got our teeth, and this is from the side, okay? And then it kind of hinges like this, all right? So this is the back, and this is the front. Your lips are, you're like that. Okay? And that's just terrible, but okay, you get the point. These are the lips here, okay? So what happens is when they come together, right? They can lock into place, and either you try to grind and then you start wearing them down, like that, or they just clench and snap into place, and that causes different, your temporalis muscles right here, that can stress out this muscle, right? And your temple hurts, and you're like, man, this is an issue. What a bite guard does is it just, see the space here? We'll just make that our little bite guard. So we have two kinds. One is just in the front, and it looks like a little bird beak, okay? It just fits on the front two teeth. And what it then does is it keeps this open just enough. It's just a little tiny opening, just enough that then you can grind back and forth or side to side, and you're grinding on the plastic. You're not grinding on your teeth anymore, right? And it allows your jaw to move freely so that it doesn't lock itself into place, causing the tension headaches, right? Because if you're clenching, you're locking it into place, and you're not necessarily moving side to side. You are locked in, okay? If we make you a whole mouth guard, okay, then obviously it goes back all the way, and it covers either the upper or the lower. It doesn't matter. We made one for a lady today that she has very limited opening because her jaws are just tight as can be, and I think because she's clenching so much. And I said, you know what? You might be more comfortable with a lower one, okay? So a lot of times we can make lower ones. If you're a gagger, if you just hate having something in your mouth, ask your dentist, hey, what about a lower one? Usually they're a little bit thinner, and I think they're a little bit easier to get used to compared to a full upper one, okay? So that's the whole premise behind this, is that it opens your jaw just a little bit, okay? Yes, you could drool more. I've had complaints about that. Well, I'm drooling more, and I'm like, okay, put a pillow on your pillowcase, okay? Or change your pillowcase. Oh, I might be snoring more. Well, I can't solve every issue. I'm trying to solve your headache issue and from you clenching or grinding, right? I can't help it if your mouth's open a little bit and you're making more noises, Put in some earplugs. Tell your spouse, put in some earplugs. It's going to be, a louder night. But at least you're going to wake up and not have any kind of issues with your headache and think that you have to be on drugs, right? So I'm going to show you these two types of mouth guards, and there's so many brands on the market, but I'm going to show you a couple that we make here, and the one has a couple different sizes, and it just depends on, do I need to make them bigger because they have big teeth or what? So give me a second. I'm coming over here to show you. All right, so you got this little guy. See him? Hey, BJ. See him? This one is called an NTI, and we make quite a bit of those. The NTI is that small little guy that just fits over the front two teeth right here, okay? Now this one is the same one, it just, if they have bigger teeth. But see, it's real small. And what we do is we just line it inside here with some stuff, and that helps to fit it on the teeth. And then you have the traditional one, okay? Now this one is for an upper one, and you can see, and it's not too thick. You can see that. And these ones are a little bit hard, but they do have some flexibility. And it's not as big as one you would get over the counter. You can buy ones that go, you know, are over the counter, that are the boil and bite ones. There are some other, you know, designs in that you can buy online. The problem with those is they're not custom fitted. A lot of times they're too big for the patient. They gag them. They don't fit right. They don't stay in. And, you know, most of the time people try that. And I tell them, if you want to try it because you're not sure if you fall into a TMJ or headache category, then buy the $10 bite, boil and bite ones and see if those work for you. And then obviously, if they do and you want something different, or if they don't and you want something different, then we can make them for you. So, if you have any of these symptoms, you should go get checked out, okay? The first symptom is headache. So this could be someone that's clenching or grinding. We don't know yet. 2, see wear on the teeth. So on the tops of the teeth, on the biting surface, if they're not as pointy as they used to be, you're probably grinding. So we'll put a G there. Headache could be a grinder or clencher. So we got a G and a C. Okay? Either way, one of these little guys can definitely help, okay? If you see wear, you're definitely grinding, and then you could start grinding on the bite splint instead of yourself, okay? 3 is teeth don't match. You wake up all of a sudden and you're like, oh my gosh, my bite's off, okay? That's definitely a dislocation of the actual jaw. That doesn't mean you're grinding or clenching. That means that something's happened with the jaw and it needs to go back into the socket, right? It's like if, you know, your shoulder's out of socket, it doesn't feel good, right? You got to get it back into the socket. So that's definitely a chiropractor thing, okay? So go immediately to the chiropractor because they can help manipulate it. And it might take 3 to 5 sessions for them to truly get it back into the joint. The TMJ joint is one of the most difficult joints to deal with as far as dislocation. So usually other joints you can kind of manipulate back into place, but the jaw is just a pain in the butt and it's a lot harder to work with. Number 4, so we got teeth don't match, you see wear. Do you have any popping in your joint? Or clicking sounds? Does it sound like gravel? Most of the time, this is a grinder that's going back and forth. What can happen is you can actually get frays or little pieces of the cartilage, because you do have a little piece of cartilage in there, and if you're going side to side, back and forth, that can damage that cartilage, and you can get little pieces in there. You can also fray the cartilage, just like a kneecap, a meniscus, that kind of thing, where, you know, you've got little pieces in there, and that can cause popping or clicking, okay? That's definitely a grinder, and that's definitely something that can be handled with the mouth guard, okay? Number 5 is, do you sleep on your stomach? And that's not necessarily a symptom, right? But if you tend to sleep on your stomach, you're probably going to get one of these other symptoms. You're going to have a headache. A lot of times I see the popping and clicking, or the teeth don't match and you've actually dislocated your jaw. Or sometimes you get a new pillow and all of a sudden you're like all out of whack. You're like, your neck hurts, your jaw hurts, all of that. Why? Because you're dislocating that joint a little bit. So that's something to think about. Make sure if you're sleeping on your stomach, try not to do that. That's the worst position you can sleep in, especially for your jaw joint. But another thing is, if you get a new pillow, and I ask people, okay, I've seen you for 10 years and you've never had a jaw issue. Why all of a sudden are you having headaches and a jaw issue? And a lot of times it's because they've had, either they're sleeping on their stomach or they got a new pillow, and instead of it being square, it's too fluffy and it's pushing their neck and their jaw out of alignment. So if you have any of these kind of symptoms, probably the sixth one is just tightness. You wake up, you're feeling tightness in this area in your temporal, and also limited in your opening. So if you used to be able to eat, a big old hoagie sandwich and now you can't anymore, that's something to think about. So here are 6 symptoms that if you have any of these symptoms, you could be clenching or grinding and causing tension headaches or causing damage to the TMJ joint. And that's something that a dentist can surely handle, so that you're not taking any type of drug that, nobody wants to be on medication for the rest of their lives. We can usually get rid of these symptoms if you wear a little bite guard, okay? So we've got 6 symptoms. If you have any of these 6 symptoms, go see your dentist, okay? The first symptom is headache. That could be from either grinding or clenching. The second one is you start seeing wear spots on your teeth. That's definitely someone that grinds side to side. Number 3, the teeth don't match up, so your bite's off. That's definitely a dislocation of the TMJ joint, and a chiropractor is going to be needed to manipulate that joint back into the socket. Number 4 is popping and clicking. That is definitely damage to the cartilage of the TMJ joint, and that's usually from grinding. And it could also be arthritis or from trauma, but usually it's from a grinder. Number 5 is not necessarily a symptom, but something to think about. If you are sleeping on your stomach and you start having these other symptoms, that's something to think about. You got to get off your stomach, and also make sure that any new pillows are a little bit flatter and not too fluffy. And the last symptom is tightness or limitation in opening. Usually that's from someone who clenches, because they're building up the lactic acid in these muscles and they're driving that bottom jaw up, and that can cause issues, okay? So if you have any of these 6 symptoms, that's something that you should go immediately to your dentist, especially if they're happening, I would say anywhere from 2 to 3 weeks of constant symptoms. Then it's time to go see the dentist, okay? And a lot of times we just make you a little bite guard. We either do a full bite guard like this one that I showed you earlier, or we can make one of these little NTI devices that just fit over the front 2 teeth. So make sure that you are getting yourself into good sleep habits, and you don't necessarily want to be medicated all the time. It's something that most tension headaches can be handled with a simple bite guard, okay? I know for our office, if you're in the Akron area, come on down if you have any of these symptoms. We're running a special this month. We got another week left. We are doing $100 off of a mouth guard, and I'm not sure what the price is because it depends on your insurance plan. Normally they start out at $295, I think, so it would be $100 off of that. Some insurances pay all of it, some pay half, and some don't pay any. So it depends on your employer and the plan that they chose for you. But if you have any of these symptoms, please don't suffer in silence. Don't think that this is just how it's going to be. and you're just going to be in pain for the rest of your life. Let's get the jaw separated a little bit, and let's let those muscles relax. So that's it for me. If you guys want to jump in and create better habits in your life, grab a free copy of my book, The Habit Formula, by going to thehabitformulabook.com. I hope everybody has a great day, and I'll see you guys mañana.